Guys, we're in the middle of the pandemic and these are trying times. It's hard on our mental health, our mental state. And this is why I love our sponsor today, BetterHelp. They're the largest online counseling platform worldwide. They change the way people get help with facing life's challenges by providing convenient, discreet, affordable access to licensed therapists. BetterHelp makes professional counseling available anytime, anywhere, through a computer, tablet, or smartphone. It's brilliant. Sign up today. Go to betterhelp.com/solvinghealthcare and get 10% off sign-up fees. Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Quadcast Nation now begins. Welcome back, everybody. Thank you for joining us. We have one of my favorite human beings, Dr. Monica Gandhi, infectious disease doctor, HIV researcher, and holistic approach in COVID, not only researcher, commentator, article writer, like just a wonderful human being talking about how we need to be more holistic. In this podcast, we go over why she doesn't think a third wave is coming, the value of vaccines, when we're going to get back to normal life, why instead of cases, we should be looking at hospitalizations. We talk about school closures and how that's impacting the kids and society and so much more. You guys are going to love this one. Before we dive into it, a couple things. Check out our Solving Healthcare store at solvinghealthcare.ca/shop. We got our summits. Low carb. We got our resilience summit as well. We got our merch. Know what I'm saying? So don't hesitate to check that out. Also, reach out to me at quadcast99@gmail.com if you're looking for any speaking engagements. This has been one of the blessings for me in 2021, being able to reach out to our community when it comes to systemic racism, when it's COVID response, comes to ICU and resource utilization. It's been a real privilege to be able to send the word out to all you cats. So reach out if you're looking for a guest speaker or keynote speaker. We really appreciate it. Okay, we're just going to jump into it. Monica Gandhi, as I mentioned, researcher, COVID informer, and just an overall wonderful human being. We're going to dive into it. So without further ado, Monica Gandhi. Quadcast Nation, we have a recurrent guest, but not just any recurrent guest. We're talking Monica Gandhi, okay? Like she is already, I want to say, like the queen when it comes to HIV research and just overall common sense-ism, knowledge throwing down-ism when it comes to COVID. But she's been a refreshing side to this whole COVID discussion. And I was so pleased to have her back on the show because I know you're a hot commodity, Monica, right now. Am I wrong?
No, I'm not.
Oh my God. You just told me today you got some busting out in USA Today, which we'll allude to in a second. But
you and I have both been very advocating for the school issue.
I mean, we can jump on it right now, actually.
Yeah.
School closures. Okay.
Yeah.
Where can we start? I've been of the proponent of keeping them open, not only because of they don't seem to be a major source of spread, but obviously for the negative consequences for our youth and also the disenfranchised because they're being impacted the most by school closures.
It's a human rights issue.
How do you feel? Yeah. How do you feel? Tell me about this.
So I think there are four things actually, and this is the easiest way to break it down. I think that the human rights issue is a real one, that the mental health effects, the obesity, the depression, everything that's going on is really rising to the fore. And the second, with school closures. Second, we have to say that children are not at significant risk of poor outcomes from COVID. As of March 3rd, 286 children have died from COVID in the US. Each death is a tragedy, but that is actually similar to the number who die of influenza. compared to greater than 420,000 deaths in adults. So it is something that affects children, the infection itself. And MIS-C is rare but treatable. Mm-hmm. Second, like you said, viral spread doesn't occur in schools if you use the appropriate mitigation strategies. Mm-hmm. And Dr. Herg, who is the author of this Wisconsin MMWR study, was really surprised that the CDC took her study and said, why would you use community prevalence as a marker when you can open? Because the Wisconsin study, some of the community prevalence rates were over 40%, and she showed 0 transmissions to staff, 7 across many 4,000 students, 7 infections in children didn't occur in school. And then third, no science supports the 6-foot distance. I'm sorry that you guys are metric, right? So yeah, I'm thinking.
I think they make us do 2 meters.
Okay.
Which is like 6.
No science seems to support that. And actually her Wisconsin study, she submitted a reanalysis to a big journal to show it's really 3 feet or 1 meter. And then variants will not affect any of the school openings. So yeah, we are in the human rights world at this point.
This is, I mean, when you frame it that way, when you really think about what is being sacrificed, and it's the thing that always kills me with my kids, because this is what is when the gloves came off, when locally, when they decided to close the schools, when our community transmission was low. We had maybe at the time 3 in the ICU in a city of 1.2 million-ish. But it's just like they're the forgotten pieces of this. They're being sacrificed, and to me, it's just unacceptable. You know what I'm saying?
I think that is now the word, unacceptable. That's what Dr. Herg said when she sent out this USA Today on Twitter today. She said, unacceptable that we're sacrificing our children at the altar of fear.
Yeah, no, and we're gonna pump this is March 9th. We're gonna pump this episode out as soon as possible, but you'll see us pump that out on social media. You're gonna hear me hustle because Monica's got a limited time, so it's gonna be almost rapid fire. Okay, here's my question for you: do you anticipate a third wave? We have a lot of analysts and I'll say politicians too, experts that are quite anxious that we may be going into a third wave. And I understand you're in a different part of the world. You're in California. I'm up here in Canada. But your overall impression about the risk currently of a third wave happening?
Not at all. And in fact, it would be our 4th in the US, but not at all. I do not anticipate a 4th surge. 4 reasons for that too. I like 4. One is that unlike any other surge, something massive is happening. We're not just using one more tool in the toolkit. I really hate that expression for vaccines. We're applying the ultimate solution, the veneer to protect us, long-standing, which is vaccines. So as we're seeing all these cases and hospitalizations drop since the 3rd surge in this country, it's not dropping like slowly and gradually because we're staying away from each other. It's dropping like a stone because of vaccines. Second is that, watch the UK where they're doing, we have to give them credit, right? We both, I'm from India, so we have the UK history, but the UK has done an incredible job with vaccination. National Health Service, by definition, allows this. This sort of distribution. They have decided to approve an adenovirus and a 2 mRNA vaccines. They're doing it fast. And despite B117, which will be my 4th reason, with a variant circulating that could be more transmissible, there's still really reduced rates of hospitalizations and deaths. And then 4th, people are saying it's the variants. That's why we're going to have another surge. Mm-hmm. Boy, these vaccines work against the variants. I'm going to put it really simply. You can quibble about antibodies, and there'll be some like lower neutralizing antibodies, sometimes against some variants, but boy, remember medical school and how remember about how we learned from about immunology against viruses. It wasn't antibodies, it was T cells. And I think about the T cell a lot because I'm an HIV doctor, and HIV affects the T cell, but those T cells will still be that you develop after vaccination will still be active against all the variants. So I do not think we'll have a 4th surge. No.
Yeah. And honestly, this might sound a little bit extreme to say, but in some ways, I don't even see how it's logical. Like, you know what I mean? Like, I don't see how it's logical when it's locally here or in our nation, we've vaccinated at least our most vulnerable. We're nowhere near the levels that there are in the US. But for all the reasons you've mentioned already, we're going into the spring, like we're getting into more outdoor activity. There does seem to be a seasonality to this.
Yes.
So, I am with you there. But like I said, I actually don't even see how it's rational that some of our experts are saying, expect a third wave.
Fear, fear, keeping people away from each other, shame, stigma. I mean, we've seen this, right? Like it is really okay to give good news about the vaccines. It's really okay to start messaging optimism. It's really okay to say we're going to get out of this. I deliberately watched Contagion the other day because I had never seen that movie. And, this was a terrible infection, whatever this was, meningitis, encephalitis, seizures, respiratory, immediate death. And as soon as they got the vaccine, people were cheering up considerably in the movie, at least. They were like, this is it. This is the solution, right? And so I was surprised. I'm surprised to see all the doom mongering, doom and gloom right now.
I think I may have heard you say this on another show, but it's kind of what we were talking about amongst our group was the people that there's a few things. The people that are fear mongering or hyping up the variants and so forth, often they don't see patients, right?
Yes.
And often not having that perspective, like not having that holistic evaluation. Like you and I, like when you see a HIV patient, you have to look at things holistically, personalize it. What's going to work best for that patient? Same when I'm in the ICU, when I got the cardiologist and the nephrologist saying like, more fluid, no diuresis. Like this is my call. You know what I'm saying? I'm like, what's best for my patient at this time? I think that piece is missing when you're not at the bedside, and the additional component of they're getting a lot of attention right now that they never had before. I mean, maybe they have, but not that I've been aware of.
I totally agree with you. And this is not, what you just said is just really profoundly reasonable. I was thinking about this last night, actually. MDs are the ones who are in the ICU with the COVID patients. And then they were the ones that are in their outpatient setting, or in your case, seeing patients without COVID. And they do have a different perspective on the illness, right? Like they have the perspective of seeing the illness. They also have, importantly, the perspective of, I've never sat in front of a patient and said an absolute. Like I've never said to a patient, wear a condom or else. And I've never said stay at home to a single individual, because stay at home is, belies that some people have to work, that some people are lonely, that some people are widows, that some people are single, that, it's such a stigmatizing statement. And so I think that MDs are looking at this differently right now and have informed this response differently. And I don't know about the attention, but I do have to say that there's been a reward for people to go on TV and say really negative, scary variant, surgy things. I've watched these TV stations and newspaper articles put this out again and again. And I think it's rewarding. I've thought about this phrase of addiction being linked with fear, because I do work with addiction. And there is something there's a hook that comes with fear, right? There's not really a hook that comes with pleasant, nice, good stuff. There's a hook that comes with running from the saber-toothed tiger, and it gets everyone's adrenaline up. And I think these messengers are getting and the media are digging deep into whatever it is in our psyche that makes us addicted to fear.
And it's effective. Like I was, believe it or not, I'm like one of 3 brothers in the world that went cross-country skiing this morning. And
you Canadians.
Oh my goodness. It wasn't like traditional cross-country. It was like skate skiing too. It's like very, not ethnic. I'm allowed to say that. And
Indians don't either. Okay, got it.
And I'll give them the benefit of the doubt. Maybe it's a lady that had some kind of, I don't know, immunocompromised condition or lung condition, what have you. But outside, like triple mask kind of thing, you know what I mean? And I've seen young people do the same thing. The short version is I think the fear messaging has come across. And one thing that's been lost is kind of like people really knowing what their risks are. Like, you know what I mean? Like,
yeah,
like a 23-year-old that is, you know, with no conditions, like, I don't know if many of them really appreciate how little of a chance they have to die from COVID. You know what I mean?
We have to take fault for that we seem to have messaged this COVID message differently in a way, because you're absolutely right. Children, I mean, I just quoted you the statistics at the beginning, and we've kept school closed for a year in some places. It's appalling, but their risks are very low. And then you're right, young people's risks are low. So that's why actually I watched that movie Contagion, because everyone dropped dead. It was horrible. It was a horrible movie. Little children, older people. It was just a horrible paramyxovirus or whatever they were making up. And this is not what SARS-CoV-2 is. And so the fear, has penetrated. And there was this article in Washington Post this morning called Fear of Normal. Dr. Lucy McBride coined this term FONO. It used to be like fear of missing out. Mm-hmm. This is now fear of normal. That what is it going to take that as these vaccines take hold, that mercifully cases and hospitalizations are dropping, that this is the ultimate solution of the pandemic? What is it going to take for us to greet one another again, to shake hands, to hug, to, not have that flinching aspect that you have described the last time we spoke, that people have flinched away from their children, not, just this fear. I mean, what does that teach a child, that someone's flinching away from them? And then, the fear of like being outside where the ventilation is so clearly on your side and you're not going to get COVID, but having that excessive masking.
Yeah, I hope. I mean, it's a good transition actually. Like, when do you think we'll get back to normal life? Like, I was asked a question on an interview the other day, like, when will it be safe if grandma is vaccinated? Can she hug my grandkids or whatever? And I'm like, I'm sorry, but I hope so. Like, what's the point? What's the point of this if we're going to be?
That's one of the saddest questions that I've heard in the last month. Can grandma hug grandchild? It's so sad. And we keep on doing story after story. By the way, resounding yes, right?
Yeah, no, absolutely. Right. But yeah, in your opinion, do you? I mean, it's kind of I don't want to give you like point towards a date where you think things will get closer to normal. But what in your mind, is there a timeline where you think we're hugging again, we're going to concerts, we're in boardrooms together again? Like, is there a timeline you perceive?
Yeah, I have a theory about this. So number one, I'm proud of Canada, not because they're rapidly rolling out vaccine, but they're going to. Yeah. The reason I'm proud of Canada is that you approved 4 vaccines. And I was very impressed with that, right? Because that's going to increase supply. That's going to increase the rollout. You're going to do the 1 dose and wait for a while. And that is all appropriate. That's what the UK did. They only approved 3. You're approving 4. So you're upping the game and you'll get it out fast. So you're, I hope, making up for last time. We are vaccinating more quickly here in the United States. And I'm watching Israel and the UK as the fastest rollers out. And they are already starting to release that fear. And in Israel, they're actually doing immune passports, and you can go into crowded theater. But ultimately, I think that if I project this out, if everyone, a U.S. person at least, can get it by the mid or end of May, you get your first dose, then second dose 3 or 4 weeks later. I'm thinking mid-July that life is going to be very normal, and maybe September is extremely normal. The question is, what will it do to take people's fear away? I've also been thinking about that, and I'm not sure. I need to look back at history books and understand this more, but I have heard that the Roaring 20s that happened. Have you heard this?
Yeah.
That happened after World War I was not just because of the pain and misery of war, but because of the 1918 pandemic and our relief in seeing each other without masks and being close to one another. And there were parties, and there were pretty dresses and Great Gatsby. And, so I am hoping that the human spirit will indomitably shine through, and we will stop flinching at our fellow man and, be even closer than ever. That's what I'm hoping.
Yeah. And honestly, on paper too, when you think about not only the amount of mass vaccinations that are going to happen.
Yeah.
If it's similar to the summer where you're seeing minimal cases that are going to be in hospital and intensive care units, you'll see the cases. I don't know, maybe the cases will fluctuate. I'm not sure. But that slow confidence that you'll see. And the other thing that I'm excited about the States, like from a Canadian perspective, that sounds like there's already areas that are like open. You know what I mean?
Yeah.
If I'm not mistaken, Texas is open.
Yeah, they may be going a little too fast,
Right.
but the experiment will play out. And that's the other important thing, is that we should be scientifically true. That we need to see what's happening in Texas and then versus California. California is doing it slowly. That I actually approve of, lifting restrictions slowly with mass vaccination. But if Texas shows us that the mass vaccination is so fast and lifting restrictions didn't do damage, I would hope that media and scientists would report on that accurately.
Yeah.
So one thing I do want to go back to something that you said that's really important: hospitalizations, deaths. We would not have gotten into SARS-CoV-2 trouble if there were cases of SARS-CoV-2. We wouldn't have even been swabbing people's noses. It was really the severe illness that got December 31st, 2019, the declaration to the WHO that this is what's going on in Wuhan, and then the declaration of the what this was, SARS-CoV-2, on January 11th, and then unfortunately the declaration of the pandemic on March 11th. Which is, by the way, tomorrow, 1 year anniversary. It's severe disease, it's hospitalizations, it's deaths that is so troubling and so terrible. You've seen it firsthand as an ICU doctor. And so I think that one idea is to look at that metric and as our most important metric at this moment, watching it drop like a stone, which it is. I watch it every day. And then the cases, like you say, they could go up and down depending on your testing, depending on variants, but it's the hospitalizations that we care about.
Yes, and it ties to Monica, because I've been, anytime I get a microphone or I'm doing any media now, this is the marker, okay?
Yeah.
And the reason I think it is, which I'll get you to comment on, is the actual effectiveness of these vaccines. Like, we get caught up in the numbers, like this is 68% efficacious and so on. But when we actually look at the most important metrics, going to hospital, going to like end up on a ventilator or dying, it's almost unbelievable to say how effective these vaccines are.
Unbelievable. I mean, yeah, that's exactly right. And there will be statistical quibbles about that. Like I've seen it lately, but this is the issue. Okay, if you think that the number of severe outcomes were limited in the 8 clinical trials that have shown the finding that you just said, that severe disease, hospitalizations, and deaths are almost completely eliminated by the vaccines. If you find these clinical trials limited, let's do real world. It's so December 2020 to think about the clinical trials. We're in March 2021. We have real world data from Israel, from the United Kingdom, from nursing homes here in the United States, where hospitalizations in those who are mass vaccinated, our CMA data are so low now that nursing home residents in the United States have been mass vaccinated. So if you want to quibble with the clinical trials, let's look at real world data. Have you ever in your life as a doctor had something be rolled out like seconds after the clinical trial data was in press release and playing it out on the world stage so that effectiveness can be examined just as we look at efficacy of the clinical trials? It's like effectiveness is mirroring efficacy in the clinical trials, and we're watching it happen. It's unprecedented.
It really is unbelievable. This is one of the things I'm hoping we take away from COVID is the what's the word? Like the go get them, like the get rid of the barriers, have that the agility to think if we're gonna evaluate something, we're gonna do it aggressive. We're gonna try and learn quick. You know what I mean? And just embrace the findings and adjust our interventions or therapies accordingly. Because I've never, in my world in ICU, we have proven therapies that are 10 years old that we still don't adopt well. Do you know what I mean?
You know, it's interesting, and I'm going to put in a plug for my community. I think HIV informed COVID regulatory process and made it happen faster. I really do. I'm going to give credit to the HIV advocates at the beginning of the HIV pandemic that, literally stormed the FDA, said you need to regulate, you need to put out emergency authorizations quick for drugs in this life-saving drugs in HIV. You need to do parallel tracks and change to compassionate use later. You need to review grants quickly. And I am proud of the HIV community because I think it set a precedent for things happening more fast. But also, if the whole world screeches to a halt and you throw money at a problem and you're in 2020 and there's all this technology available, it worked. It happened. It happened fast. And I don't think we'll ever go back to things happening slowly, at least on a worldwide emergency. I hope that happens.
I hope you're right, Monica. And
in other fields.
And it gets back to your Roaring 20s point, actually, a bit. The fact that like a year later and we have these vaccines, like we really should be like
jumping up and down.
You know what I'm saying? Like
I can't stop jumping up and down until okay. Just this morning, I looked at the CDC website and they called vaccines one more tool in the toolkit. I'm like, no, man, no, my friend, no, panacea, solution. Tool in the toolkit is like a nail. Tool in the toolkit is like mass distancing and ventilation. Panacea, solution, ultimate tool, right? Not a tool, it's the solution.
Yeah, absolutely. It is, and you mentioned it too. Like, there's other. What's the acronym we all use? Intervention. Anyway, there's all these interventions that we're doing that really mitigate risk, and
yes,
but vaccines is
non-pharmaceutical interventions.
Yes, thank you.
NPIs.
NPI. Thank you.
Those were applied. They needed to be applied. I would argue that places like Japan actually applied them really effectively without strict lockdowns. They used their masking, ventilation, and distancing to their advantage and still kept many places open. They used this 3Cs acronym. We, depending on where you were in the state, used a lot of lockdowns. But NPIs were the tool before. Those are tools. And then I consider the vaccines the ultimate protection.
What's the 3Cs?
It stands for close contact, crowded spaces, and there's something else, but I actually think it means cover up with the distancing. Okay. The masking. So they applied 3Cs as their strategy. They've had very low rates of severe illness and death, and they've also had much less impact on their economies and on their school children because they took the biology of the virus, which as soon as we figured out that masks work, the distancing works, and that ventilation, not going crazy, but ventilation works. It doesn't have to go crazy. I think that's what the school study showed, open a window. But those three strategies, I call the three, most important NPIs, non-pharmaceutical interventions, and they applied those and still kept things safe. You can't sit next to each other in a subway. You have to sit, far away from each other. But they applied those and they kept their rates of severe illness and death. And they didn't do the amount of lockdown that we did in the United States, at least.
You know what that is? That's learning. That's trying to live with this thing. You know what I mean? Like you're trying to keep your humanity. And keep your values and your roots. Because it's amazing. I can't quantify it. Maybe you have a better appreciation, but I don't even know if I went to my kids' class right now, if the window would be open. But these things are they're effective.
They're so effective.
And we don't.
And we learned
just talk
about them
this.
Pretty quickly. We learned about them in March 2020. So by April, we could have applied them more effectively. I actually just wrote a paper with it's in OFID, just got published. It didn't get any attention. That's okay. But it's in a business.
It will now. Canada's #2 medical podcast. What?
But it was in a business. I wrote it with the business person where they never closed. They never closed their business, not even once. And there was multiple sites around the country. They just kept it open with these three NPIs, mask, distancing, ventilation. And their rates of severe illness were so low. I mean, basically, it turned it into a cold. Like if anyone got sick, it was just like the school studies. The transmission didn't occur within the business if you applied those three. And I use that as an example that we could have applied more effectively all our knowledge and done that, those three NPIs, while we were waiting for the ultimate solution of the vaccine. But instead, because of this culture of fear, there were a lot of closures that have collateral effects, like on children. So I hope, give that some attention. That'd be nice.
We'll give it some props for real. This kind of ties into a little bit of so I'll tell you a quick story. I'm going into work. There's an area where we get our scrubs or whatever. Because I'm still a growing man, I have a massive lunch kit. And I was on the phone, I think, at the same time. So I put my lunch kit down, and the employee was like, "Sorry, you've contaminated this area. Can you lift up your lunch kit?"
Oh my gosh!
And I was on the phone. I was on the phone with another doc, and I was like, "Excuse me," and I'm like, "You know what? If I say something, I'm going to end up like in trouble. I'm just going to walk away and pretend that this was, I'm not going to educate her right now. She's not going to believe me." But
on the no risk of fomites and surfaces.
Yeah, it was still, people still think they need to wash their groceries,
Actually, we just did another paper in Lancet ID where we showed that hand hygiene probably, there's never been a study that even reduces the risk of SARS-CoV-2. That's actually for rhinoviruses and rotavirus, for example. So it really isn't a fomite surface spread infection. And what the story you just described, and this, I hope, you're saying this happened in March 2021. I know these terms have been coined: pandemic theater, virtue signaling. These are interesting, terms that we're going to come away with, but it can be destructive, right? Because you weren't allowed to kind of enjoy your moment where you needed to put down your lunch. You're a busy doctor in that hospital, and didn't need to be told that. And third, I actually am really worried about the I'm an ID doctor. Okay. So I'm worried about antimicrobial resistance with all this excessive use of disinfectants and all this stuff that we're doing. Oh my gosh, stop wiping down those surfaces. I mean, this is why some of the playgrounds were closed, right? You know, and that was awful. That was so awful.
I have no proof of this, and I might get in trouble for saying this, and it just might be coincidence, but I do feel like we're getting in the ICU, we are seeing way more resistant bugs. Like,
what I mean? Like, I'm saying, clenched my infectious disease Dr. Hart and broken it in 10, because we can't have, this is this phrase, this is just a new phrase, right? Collateral damage.
Yeah.
The collateral damage. I mean, we can spend the whole time saying the school closures, the overdose deaths, but I really am worried about the excessive disinfection.
Yeah. Like, I know we're in different areas, but if I get a critically ill patient now that comes in with, septic shock, I'm worried that the Pip/Tazo, one of our strongest antibiotics, isn't, depending on, it might not be fair game. Like, and I certainly have colleagues that are, and that will be going to meropenem, Vanco, for example, if someone's coming in with,
because those antimicrobial wipes are like full of broad spectrum kind of antibiotics, and I don't want those around for bacteria to see them. It's just so wrong. It's such a selective drug pressure. Yeah, no, and this is the first conversation I've actually had about this, but because once again, I'm often too afraid to bring this up because it's when it comes to secondary consequences, often it could be. But people could be Don't
very
be afraid.
critical.
You're on the right side of history. Actually, keep on thinking when I look at your tweets and I look at your podcast, you are on the right side of history. And so even though both of us probably get yelled at a lot, actually, I've been yelled at so much more than I've ever been yelled at during COVID. I never get yelled at usually. We are on the right side of history to think about school openings, to think about the safety for children, to think about overdose prevention, to think about antimicrobial resistance, to think about the collateral effects, especially now that we have vaccines and we are going to shut down this pandemic.
Yeah, no, I think I really appreciate you saying that, Monica, because, and I'm preaching to the choir here, but, at the end of the day, for me, I got to look at myself in the mirror.
That's right.
The other thing I got to do is I look at my three boys, and, it's been preached from a young age. You stick up for those that can't stick up for themselves. like justice is an important thing. Like, I'm sure you've been, as a woman physician, as a, an Indian background, you've been, had a ton of injustices shot towards your way, and how it feels, and how it's wrong. And I think that's why I think personally that's I wear it on my sleeve. Yes, might impact career, might impact public opinion in some places, but I don't care, man.
I'm extremely proud of you, and I'm proud to know you, because I think anyone, and there's just like a handful actually of people, because a lot of people believe this, right? Like what we're talking about, but they are not talking so often about it. But they believe it. That's why you have so many followers and people cheer you on and all that. But people may not speak out as much, but I am proud to know people who think holistically about the devastation of this virus and the devastation of the pandemic response to this virus and the disproportionate impact on the poor, the working class, those who go to public schools. And I am proud to be around anyone who thinks holistically and makes decisions accordingly and speaks out accordingly. And that's you.
And that is you as well. Champions. I'll tell you this, we will look back at this and say, I still think, maybe this is inappropriate to say, but I don't know how many years it will be from now, but some of our response, people will be like, what the hell were we thinking?
Yes.
What were we thinking?
Which is good, because then hopefully it wouldn't happen again. Mm-hmm. And so, when I closed on my Twitter account, the minute the pandemic is over, people can look back at old tweets from everyone and say, oh, what were we thinking? What was the collateral damage?
Yeah, no, absolutely. Listen, Monica, I want to be cognizant of your time. This, as always, is spectacular. And let me tell you, like, I think you have a lot of fans that you probably don't know about, but like I've actually, one of my colleagues, Suman Chakrabarti, was like, you've interviewed Monica Gandhi? Like, this is one of our national ID docs who does a lot of media. It's like, how can I get a hold of Monica? I just want to let her know how much we love her and how much she's.
I like anyone who's infectious disease and who's of Indian origin, because it's not that many of us. No, sometimes absolutely. They go into cardiology and GI. So yay, ID to Indian doctors.
It's so true. It's so true. Am I allowed to say that? I just did. Anyway, no, what your advocacy, and like you've seen, you have just gone like this, and you'll be one of the people that will look at the end of this thing, whose message people will be like, remember Monica's message, how it meant so much, how we need to be looking at things more holistically and just having that non-fear-based communication, that realism. You know what I'm saying? This is going to rain. People will be thanking you. You're going to close that Twitter account, but then you're going to reopen it because people are going to be like, yo, they want to just give you some love, man. This is the truth. So like
people can send letters through the mail. I can't wait to close
through
Twitter.
The mail. What is that? Circa like 1983. Yeah. But I gotta, like, once again, just much love. Thank you for agreeing to do this. You're a superhero, and you've been a role model for me, for real, and giving me the courage to be more outspoken. So thank you.
My respect and admiration is right back at you. So thank you very much for having me.
Absolutely.
Thank you.
Quadcast Nation, tell me Monica ain't the most wonderful human being you've heard in a while. Thank you once again for listening, crew. Leave any comments at quadcast99@gmail.com. Follow us on Twitter, Instagram, YouTube at Quadcast. Yo, leave that 5-star rating. Come on, yo. iTunes, Spotify, wherever you listen, leave that 5-star rating. Leave a review. Helps with the visibility of the show. As you may have heard on the show, we recently were number 2 in the country. Let's keep up the hustle. Let's continue to change that boogie, yo. For real. Anyways, thanks so much for listening, crew, and we'll connect again real soon. Peace.